How are you, ma'am?
Good day, sir. How are you?
Good. You're the president of the Young Democrats of Baltimore.
Yes, I am.
What'd you think of today's policy briefing?
In spite of all the rhetoric with the Republicans and the message that they're putting out about the president and how the Democrats are divided right now, this kind of gave me clarity and more defined decisions and why the president made decisions that he made in regards to the healthcare initiatives, in regards to all of the budget initiatives that he's implemented. I think it helped most of us in that room really be more confident in why he made decisions that we made. So now I'm able to go back to my community with more defined goals to say why he made the decisions that he made and why we need to stand behind our president on this thing.
So, in a nutshell, you would agree that the messaging is a key challenge to this presidential administration. The messaging.
Yes, yes.
What? Why?
Like the gentleman said earlier in the beginning, the reason why we were all brought here today was because they lack the initiatives to go at the grassroots level. They are always working with the congressional members and your high-level elected officials, but sometimes they forget about young people such as myself who are on the ground, who are constantly in the churches, who are constantly in the community-based organizations. They don't get that message out to us. We often have to rely on our peers who work at the White House or the Washington Post or the Washington Times or the Baltimore Sun. But we're here today to find out for ourselves the truth about why he made the decisions that he made.
Or bemorenews.com.
Don't be more than
They talked about health care reform, the Affordable Reform Act. They also talked about the economy with the economic advisor. Anything stand out in your mind from today's briefing?
The main thing for me as a young person that stood out for me is the initiative to make sure that dollars went back into the healthcare initiative to ensure that nurses and upcoming primary physicians studying, in particular at Johns Hopkins University, living in Baltimore where a lot of healthcare professionals are, they're able to take those dollars and they're taking a lot of that money from the healthcare initiative to make sure that a lot of our young people who are going into those fields will come out and basically allow the GDP to rise and the economy to become better because we have more people who are qualified and have the skills to go back out in the work field and to be competitive. That and also the initiative with, I'm going to be a senior citizen one day myself, that the healthcare costs associated with those co-payments and the gap there is with the cost of medicine for senior citizens. That was a good initiative. Also, increasing the age of young people to 26 to stay on their healthcare coverage. That's important
Of their
because,
parents.
yes, because a lot of us, when we graduate from college, at the age of 21 or 22, we're unable to find jobs. So we're able to wait a while and stay on our parents' insurance until the age of 26 versus 21, and we're out there with all types of sicknesses, and we're making the economy worse because we're not healthy. And again, that creates issues because we're then relying on the government assistance to assist us with our issues, which creates more debt. So they're also talking about healthy living, which they haven't gotten to yet. And I applaud the First Lady and her initiative of working with young people and obesity. That's another issue. So, great meeting today. I really enjoyed myself.
Good deal. Any final thoughts?
Any final thoughts? Support our president. He's in a tough position. It's easier said than done. Respect his leadership. At the end of the day, we have to all be, honest with ourselves and admit that it's a hard job to do. But at the end of the day, he's doing the best that he can do.
Keep watching bemorenews.com, the news before the news,
Thank you.
where we uncover